Welcome to another episode of the Zebra ISV Influencer Series. I'm your host, Melissa Smith, the Alliance Account Manager for Healthcare and Government Partners in North America. On today's episode, we have the distinct honor of working with Brian Litton, Chief Executive Officer from Swift Medical. Swift Medical is a digital health company focused on improving clinical and economic outcomes in the wound care management, creating a new standard for care. Let's kick this off, Brian, by telling us one fun fact about you that we wouldn't find on LinkedIn on your bio.
Sure, Melissa. It's a pleasure to be here today, and thank Zebra for having me here. A fun fact, you would not find this on my bio anywhere, but I am a certified bourbon steward. When my son graduated from college as a birthday gift, I took him to the Bourbon Trail where we tasted and learned about bourbon. And when we came back, we challenged each other to go through an extensive set of course materials and training and took exams, which we both passed with flying colors and became the equivalent of a sommelier with wine, a bourbon steward as official taster of bourbons.
That's really interesting. What a fun fact. Thank you for sharing. We're really excited about the Swift Zebra partnership. Can you explain further how Swift works with Zebra Technologies?
Yeah, absolutely. My pleasure. So Swift, as you mentioned at the outset, is a digital health company, and we're focused on leveraging complex imaging technology that was developed for the aerospace industry, specifically for space exploration. And we use this to improve clinical and economic outcomes associated with wound care management. And we have developed a standard of care for treating wounds that is now being used in over 4,000 facilities across North America. So we're headquartered in Toronto, Canada, but we have operations across the U.S. and in Canada. In fact, I sit right now at my home in South Carolina. And working with Zebra, Swift is able to turn a tablet, a smartphone, Zebra's healthcare tablets, and touch mobile computers into FDA-approved medical devices for imaging and documentation around wound care.
So tell us a little more, why wound care?
Well, wound care is one of the most costly and overlooked threats to patients in our healthcare system today. In Medicare alone, over 8.2 million patients in the U.S., and this number is sorely underestimated, are costing an estimated $96 billion annually. When you add to that the Medicaid population, that number is probably over twice as much. And shockingly, over 50% of patient encounters that involve wounds may never heal. That's why we focus on wound care. There are more people with a chronic wound than there are people with breast cancer, colon cancer, lung cancer, and leukemia combined. And that market is only projected to increase substantially with aging populations and surging rates of obesity and chronic diseases like diabetes and kidney disease.
Brian, is technology the standard practice today in wound care?
Melissa, I wish it were, but sadly it's not the case yet. Still today, it is most common to see manual methods used to document wounds. For example, paper rulers. And paper rulers lead to inaccurate wound measurements, imprecise results, and variability among the clinicians that are using it. Or even if technology is used, it's just a regular camera, which also the images vary substantially from clinician to clinician, lighting condition. The result of all of that is that wounds are taking longer than they need to take to heal. They require more provider visits, and they have bigger clinical and financial implications. Painful for the patient, but by contrast, the partnership of Swift and Zebra brings AI-powered, scientifically calibrated wound imaging, digital workflows that improve efficiency, reducing patient pain and risk, and providing real-time informed decision-making that alleviate all of those legacy issues.
Well, paper ruler definitely sounds like a scary thought, so I'm glad that you're changing the technology. What are the key business challenges that you're tackling for your customers today?
Well, I think across the entire healthcare ecosystem, you're seeing challenges related to staffing, hiring, retention, even staff burnout. So care delivery is really a big challenge. And by leveraging technology like Swift within Zebra, we're leading to improved workflow for clinicians, higher satisfaction rates among those clinicians who are addressing those business challenges in a powerful way. We also have the ability through 8 years of aggregated data to understand quite specifically the impact we're having clinically and financially. So we're able to support even new opportunities that our customers are getting involved in, such as value-based care, by being able to understand our impact on reducing high-cost items like hospital admissions, extended lengths of stay, preventable readmissions, and ER visits.
This is a really great technology and may sound a little complicated to use. Can you tell us about how long it takes a clinician to learn Swift Skin Wound?
So, Melissa, using Swift is not much different from using any other app on your smartphone. It does require a degree of training, but only 1 hour of training. We have training modules that we provide clinician to clinician to get staff comfortable using the technology, and we empower clinicians through the use of the technology to operate at the top of their licenses.
So how would a customer know they need a digital wound care management solution, or what kind of indicators that an organization would benefit from having a digital wound management solution in place?
Yeah, great question, Melissa. If you are walking around your care organization, wherever you might provide care to patients, and you see clinicians using paper rulers, you know you need Swift. If you see manual methods, if you see clinicians taking pictures on their iPhones without the benefit of the Swift app, those are environments that are perfect for the introduction of Swift. Also as provider organizations struggle with staffing shortages, time constraints, these tools help to address those issues.
So pressure injuries have a high prevalence in the US and your market. How could Swift help a company experiencing pressure injury problems?
Now, just to level set, pressure injuries are sometimes called bed sores, and those occur from pressure that comes from lying in bed or sitting in a wheelchair, and usually affect people who have limited ability to move. So these pressure injuries affect between 1 and 3 million Americans each year, and they present a significant challenge in our healthcare ecosystem. By using Swift, we've documented that our customers have realized an incredible savings by reducing pressure injury prevalence by up to 77%. And we're reducing hospital-acquired pressure injuries by 5.6 times.
What kind of ROI can customers expect?
The ROI associated with Swift touch on all of the areas that I've covered so far in terms of improvement to workflow, documentation that reduces risks of litigation. But importantly and powerfully, Swift has documented these strong, compelling clinical and financial outcomes and ROI for our customers, and we're seeing impacts on outcomes. We're seeing 14% plus reduction in hospitalizations related to wounds, 7% reduction in emergency room visits, 62% reduction in lengths of stay. We're seeing 37% faster wound healing time and 35% reduction in wound prevalence.
That's amazing. So what do you see as the biggest challenge in the wound care space today?
I think the biggest challenge in the wound care space is that the numbers are just growing significantly with aging populations and with the growth of chronic disease, and it is difficult for provider organizations to attract and retain clinical talent to support the treatment of wounds. I think when you present an effective, integrated technology solution that empowers a clinician, that drives clinician satisfaction, and thereby improves outcomes for patients as well, you're solving with the Zebra Swift partnership a whole gamut of problems that confront our customers every day.
That's great. Brian, thank you so much for being with us today and sharing your knowledge and experiences with our viewers, especially in the wound care space. You can find more out about Swift Medical if you go to swiftmedical.com, or you can also use the Zebra Partner Portal to look up Swift Medical. Thank you, everyone, for your time today. We really appreciate it. And just remember that Zebra and our ISV Alliance Partner Network and alliances are committed to your success.